So welcome everybody to our EPIA webinar, the COVID-19 Vaccination Overview, Employers Must Know, and New Technologies. Today's seminar is going to be in English. However, we have a full-on Chinese translation on every single PPT page. So if you're more fluent in Chinese, you can read along with us. 新冠疫苗接种总览企业主须知以及新技术. So let's look at the next page. Okay, so today we have the honor of inviting the Chief of Service Department of Family Medicine at Kaiser Permanente Baldwin Park Medical Center, Dr. Yushu Jack Chou. Dr. Chou, how are you?
Doing great. Thank you, Angel, for inviting me.
Yes, thank you for coming to our webinar. So Dr. Chou got his bachelor's degree at the University of Miami, his medical degree from the USC Keck School of Medicine, and his residency at the Kaiser Permanente Woodland Hills. He specializes in family medicine. He's board certified and also Physician of the Year and Service Extraordinaire Award by Kaiser Permanente in 2011. He also was honored to be the Physician Exceptional Contribution Award in 2013. So we welcome you and thank you so much for joining us. And today we're going to be talking about the topics of, the vaccination and also employee mandatory vaccination rules, health insurance and COVID-19 vaccination, and also all the details of medical news that Dr. Chou is going to provide us. So thank you again, and let's look at see what we have in the next page. So this is Dr. Chou's bio, and with that said, I'm going to go to the next page also. All right, so our attendees should stay with us until the end because we also, like every single webinar, we have a raffle for 3 chances to win a prize. Thank you. So so this is a webinar, so most of the attendees will have a listen-only mode. If you guys need to ask a question, you can raise your hand or put in the chat box to chat us a question. I'm sure you guys will have a lot of questions later on. And you could also email us at info@epiagroup.com after the webinar. So thank you for your attendance, and let's look at the next page. And just make sure that you can hear us. If you don't, then chat us also. Next page. All right, so we're gonna have introduction and we're gonna have the actual class held by Dr. Chou. And later on, I'm going to talk about a little bit about the group insurance portion of what an employer should do if you are concerned about the vaccination and also reopening. And question and answer will come afterwards. And the end, we're gonna have the raffle. All right, Dr. Chou, it's all you.
All right, well, thank you. 谢谢你啊。我是再再说一次，我是周玉树周医师。那我是凯撒医疗机构的那个保德温公园市的那个家庭医师主任。那今天我为你带来的是一些新的消息。So let's move on to our slideshow.
Thank you, Dr. Chou, for that treat of Chinese for our Chinese-speaking audience. Now I know you speak Chinese, so next time I'm going to force you to speak Chinese and do a Chinese seminar.
There you go. We'll do the full Chinese seminar.
For sure. Thank you so much.
And thank you again for the opportunity to work with EPIA and 权威保险来跟我们的华人的社区服务and bring the news to your your employers, the groups, and folks that your friends, and we were chatting earlier about your friends worrying about vaccinations and what does this mean. And so today we'll talk a little bit about COVID-19 vaccines, and as we're this is as you heard, CDC is coming out with new news. You heard about the new Johnson & Johnson vaccine. So we'll dive into some common questions about COVID-19 vaccine, and then some other associated technology that Kaiser Permanente is employing during this COVID-19 crisis, as well as our focus on mental health. So and then we'll finish up with some question and answers. So first of all, I want to make sure that this is not our first rodeo. Kaiser Permanente, we've been going through this in the healthcare world for about a year. Vaccine, we started in around December time. So this is about the 200th seminar that Kaiser Permanente in general, and I was involved in a few of these webinars as well, and to answer these common questions. So I'm going to go through some of the common questions that we heard. Hopefully this will answer most of your questions, but if you have any more questions, please put it in the chat, and then I think Danielle will let me know, and we'll have a 5-minute pause to answer some Q&As. For the vaccine portion, though, I like to focus on vaccine safety, because this is something new. You heard about the emergency use authorization. What does that mean? And then this is the hot topic for the last about a month and a half or so. It's the availability. When am I going to get mine? What tier am I in? Where's everybody in this? And then what is Kaiser Permanente doing to help with this effort? Now, first of all, about vaccines. The most common questions are, I'm worried. Is this something new? What are the side effects? And another common question now I'm getting is, should I choose Johnson & Johnson? It's a 1 dose. Do I, is Pfizer better than Moderna? Which one do we do? Are there any other reactions? You heard about, Facebook articles, Twitter, people are, tweeting out these social media things about people dying. Are these really safe, right? So hopefully I can answer some of these questions for you. Now, what we know is this, okay? To go through emergency use authorization, and so you have to understand when the FDA approves certain medication or vaccines, they have to go through rigorous scientific studies. Now, what does emergency use authorization mean? Well, usually when a medication or a vaccine comes out, it's studied in human phase 1, phase 2, and phase 3 trials, and then to prove that its effectiveness and it's safe. Now, these vaccines starting in December, okay, with Pfizer as the first one, with Moderna as number 2, and now Johnson & Johnson. And you heard about, and we haven't seen AstraZeneca, Oxford, that's coming to the United States. There's no word on that one, but that one's been approved in Europe, okay? All of these had been studied through at least phase 3 trial, meaning that it's effective, okay? So it's safe, it's effective, and now it's being used. And the reason why it's emergency use authorization is that, sure, it hasn't gone through the entire year's worth, okay, of long-term studies. Okay? And so there are some questions about, well, is this safe long-term? Well, I will tell you, at least at my medical center, 95.9% of all the doctors got vaccinated. So physicians, we read through these articles, and I personally looked through both Moderna and Pfizer before I got them, and before I got the Pfizer one, and then I read through the Johnson & Johnson studies. These are safe and effective, and as scientists, I think, and by the way, these are really ingenious vaccines, and there's some people are worried about, is this going to change the DNA and all that? These are what we call mRNA viruses and mRNA particles that are in these vaccines. And so what it does is, I alluded to, as some of you maybe on social media, about Snapchat, right? So you tweet a message, and then all of a sudden, after a while, it disappears. Okay, so this is almost like that. Is that these vaccines carries the protein that makes up the signal called the mRNA, okay, that tells your body to make immune antibodies against the spike protein. And then after it's used, it's gone. It will never make it into your DNA to change any DNA material. So it's safe, the science is sound, and we have safety protocols. Whenever you get the vaccination, you can report any side effects. And that leads to, what are the side effects? Because people worry, you heard, and this is early on, we heard about Pfizer and Moderna, and some people heard about, there are people who maybe drop dead or something like that on social media. Well, if you really look at the number of vaccines and to date, okay, I just looked up the most recent data. To date in the United States, there are 30 million people who receive full vaccinations. That means for Pfizer and Moderna, 2 doses, okay? And there are 60 million people who receive 1. And the number of people who are having significant side effects, and this is mainly anaphylactic reactions to prior vaccines or the components of vaccines. Anaphylactic reactions are like, when you have an allergic reaction, your face swells up, you're having difficulty breathing, things like that, okay? This is very, very, very small in minority of cases. Most people who have minor allergies, food allergies, all these, seasonal allergies, you are fine. You're not going to have reactions for that, okay? Now, but what are the more common reactions? Some people will have mild fever, okay? Usually not more than 100, okay? 100.4. Some muscle aches, some fatigue, some soreness at the injection site. There is talks about sometimes about a week later, you may have a mild delayed reaction where there's maybe some rash or redness underneath, okay, below the vaccine site. And that's that's very short lasting. Now, most of these resolve within 3 days. In my case, I had the Pfizer vaccine, first dose, and I was prepared, because I read up on the paper and it says, 34% of people will get these reactions. So, I'm prepared. And then I was prepared for the second dose where they say, about double the people, about 60% will have mild, moderate, or more severe reactions. Well, my first dose, yeah, I did get a mild headache. I had some body aches, not, mild site pain, but then after the next day, I slept it off. Great. So I was prepared. I took So when I scheduled for my 3 weeks later shot, okay, I scheduled it on Friday, just so I can take the Saturday off. I told my wife and kids, don't bother me. I'm gonna be sick. The next morning, I woke up feeling great. I had no symptoms. So everybody is different, okay? Now there are mild, most of them are mild, most of them will resolve quickly. And so, yes, vaccine reactions are, can be common, but there's nothing to be worried about, okay? Now, like I mentioned, small number of people do have severe reactions, okay? But so be cautious if you ever had severe anaphylactic reaction to vaccines, okay? Then consult your doctor and see if, you're a good candidate or you should postpone it. Or at Kaiser Permanente, what we're doing, we have an ongoing study because we're a large organization. We actually study the number of severe reactions, and the CDC actually keeps track of these reactions. In our experience is that if you tell us that you may have some severe potential possible reactions, we actually watch you a little bit longer. Our normal process is after you get the shot, we wait about 15 minutes. We make sure that you're doing okay. You can sign up for the vaccine reaction site, things like that. But if you're worried about that, we'll watch you for about 30 minutes, okay? And just kind of make sure that you're doing okay. And most people are fine. And so I want to make sure that folks understand that there are processes to make sure that you're going to be doing okay. Now, what about another thing? Angel and I were talking about our kids, and some schools are reopening, right? And you're hearing that the teachers are getting vaccinated. So at this moment, we're at the stage where we're in 1B, and the state of California, we're opening the vaccinations of the teachers, and some of my school district's teachers are opening. My kids is going back to school actually tomorrow. And unfortunately for vaccinations, though, they're not for children at this moment. And for Pfizer, it's only tested down to age 16. That means that for the Pfizer vaccine, when it's available for the general public, 16 and older can receive the shots. The Moderna and also Johnson & Johnson are not approved for kids under 18 years old. And so unfortunately at this moment, and they're not going to be vaccinated. Now, what does that mean? Well, the usual precautions, as schools reopen, and then if you're listening to your school districts, same thing. We're protecting teachers, we're protecting employers. Make sure the kids are protected, masking, hand washing, etc. What we know is this: kids under 12 years old tend to get milder or asymptomatic disease, especially children under 4 years old. Now, folks, teenagers 12 to 17 are the ones who potentially may be, and teenagers sometimes difficult to keep them controlled too. In part, they may transmit diseases a little bit more. So in that environment, going back to school, each school district will have to consider, what are the appropriate safeguards, etc. But at this moment, I know there are studies underway for both of the Pfizer and Moderna vaccine testing children, but that data won't be out for a few months at the earliest. And so, for the remainder of the school year, as school reopens, they're not going to be vaccinated. And talking about vaccinating and everyone's like, everyone's asking, so when is it my turn? Is it going to be available? You heard about talk about my turn. There are news stories about the myturn.ca.gov website is somewhat clunky and it's hard to get appointments, things like that. Well, at this moment, because of supply issues, and you heard about the winter storm, about 3-4 weeks ago that delayed our supply. Yes, unfortunately, vaccine distribution, unlike the regular flu vaccines, where each organization contracts with the manufacturer, these vaccines are actually contracted with the federal government. The federal government will, depends on the state size and distribution, then they'll be distributed to the state, and then the state will be distributing to the vaccinators. Kaiser Permanente is one of the vaccinators. You may have heard the news that we just opened up a super pod site in Antelope Valley in Southern California. We have a pod site at Cal Poly Pomona. Every one of our medical centers, we do have availabilities for vaccinations. One other thing that people may not know about is Kaiser Permanente. Because we are part of the greater state system, we do vaccinate about 20% of non-members. So it's not an exclusive Kaiser Permanente issue. It's where can we get the appointments? And then you can all make these appointments at myturn.ca.gov, myturn.ca.gov. And these are prioritized by the CDC, like I mentioned. At this moment, in the state of California, we're going down to age 65 and older, teachers and other essential workers. And soon, I'm sure, with the Biden administration increasing the number of doses, actually, I think, the administration's promise may be correct that by the end of May, we should have enough supplies to try to crank through everybody. We know that right now, like I mentioned, 30 million people are fully vaccinated, but that's about a tenth of the population, about 18.5% at this moment, that of the population that's qualifying had shots in their arm. So we're far away from, the quote unquote herd immunity that you heard about. Okay? And another common question is this, unfortunately, we have many folks who may have had COVID-19. COVID-19 has been around for about a year. And so should I still get vaccinated? Well, there are studies early on in New York from healthcare workers that we know that serology-wise, we can test for their immune status. And about, most folks who has had disease will retain some immunity against COVID-19 for up to 3 months. What we know is that after that, through this healthcare worker study in New York, that about a quarter of them, 25%, okay, will lose their immunity after 3 months. And so CDC is recommending that when it's your turn, even if you had disease, get the vaccination anyways, and because it will act as a booster effect. With Pfizer and Moderna, 95% effective. That was tested, at the beginning without any of these variants. What we heard about with the UK variant for Pfizer, the experience in Israel, okay, that Israel has a high UK variant, the B117 variant, and the Pfizer vaccine is still very effective. There's questions about the South African variation, but it looks like even Johnson & Johnson and these other ones are going to be effective against severe disease, including deaths. And so for people, just remember, when you get the vaccine, it doesn't mean that you don't necessarily not ever get the disease. It's not a full shield, right? 这个不是一个挡箭牌，表示说 you still have to wear a mask, wash your hands, okay? Because potentially you can still have, pass things on. Now, it's a lower risk, but what does that mean if I have COVID-19 symptoms? Well, making sure that you don't get vaccinated until your symptoms fully recover. Now, if you have symptoms, so contact your doctor's office. We can get you tested to make sure that you're going to be okay. And then once your symptoms recover, let's say in the event that you unfortunately experience COVID-19, then follow through with your doctor. And then once you're recovered, and when it's your turn, get the vaccine. And what if I just got the flu shot? So this is the middle of the flu season. We did not see flu this year, but we still recommend influenza. And this is actually the perfect time for folks who are under 65 to get the flu vaccine, because what we know is when the supply gets here, okay, there'll be probably more than 2 weeks out, okay? And so number one is we don't want you to get any other vaccines because of the EUA status. So the emergency use authorization status, we want to make sure that, people are not suffering side effects from multiple vaccines and we can't tell which one. So the CDC recommends that you should not get any other vaccines about 14 days before the COVID-19 vaccination. And then once you finish a series, which means Pfizer 3 weeks between shots and Moderna 4 weeks between shots, okay, and then 2 weeks after that. Okay? Similarly for Johnson & Johnson after. And so, yes, please get your flu shot and then wait for your COVID vaccine, okay, when it's your turn. And then the most common thing that you heard about, and I want to mention this a little bit. Yesterday, you heard news about the CDC now is recommending that one of the guidelines is once you receive the COVID vaccine, and this is, remember, fully vaccinated. They qualify it by saying fully vaccinated, meaning that, remember what I said, 2 doses of Pfizer, 2 doses of Moderna, or 1 dose of the Johnson & Johnson. But so for Pfizer and Moderna, it's 2 weeks after the second dose, you're considered fully vaccinated. 4 weeks after the single dose Johnson & Johnson, you're considered fully vaccinated. The CDC now is allowing small gatherings of all parties who are COVID vaccinated, fully vaccinated, okay? Meaning that, businesses, okay? Business conferences. We're so used to Zoom now. I'm so glad that eventually we're going to go back to face-to-face. I love face-to-face meetings, and maybe I'll meet with, I'll see you one day face-to-face. But this means that once you get fully vaccinated, you can have small meetings without the use of a mask, okay? The other recommendation the CDC just came out is that for folks who are fully vaccinated, they can visit folks who are low risk. Low risk means, in general, younger folks who doesn't have any burden of chronic diseases or other complications or immunosuppressants, things like that. So grandparents who are fully vaccinated can now maybe visit families who they haven't seen for about a year. Okay? But remember, lower risk individuals. Okay? And so you have to take that into consideration. And obviously, even with that, okay, these vaccines are not 100%. Meaning when you're fully vaccinated, it doesn't, for Pfizer and Moderna, we know that for the original COVID non-variant strains, there's still about 5%, 1 in 20 that could still get disease. They may be asymptomatic passers. And so there's still a risk. So in general, it doesn't mean that you're free to do everything you want. It's not free to get rid of the mask. Be safe. What we tell people is this: once you get vaccinated, still do the common sense things. In my practice, through this time, there are many stories where people hide out for about a year and then they relax and they say, oh, okay, now, and then invariably it's that one time that they went and visited someone and go, oh, they got COVID. And so just to make sure, okay, please wear your mask, wash your hands, keep physical distancing if it's appropriate, making sure that you're not going to mass gatherings and do what just making sure that you're still staying safe. Okay? Now, what's our role as Kaiser Permanente as healthcare organizations? And I do mention that we are a vaccine distributor. And how will we do that? I mean, like I mentioned, in Southern California, we do have large vaccination sites. In Northern California as well, we have a vaccination site that we staff at Moscone Center. So in Southern California, we have now 2 large sites. And then within our medical centers, we also will have those. And we have to follow the state guidelines as well as the federal distribution guidelines. So, we're not jumping the queue, or we're not just giving it to Kaiser Permanente members. Non-members can also call in. You can go to myturn.kp.org, and we're all in this together. So not just Kaiser Permanente. Mention my alma mater, USC, does that. I know UC systems do have those. So wherever you're getting your regular care, look at myturn.ca.gov, get yourself vaccinated. And lastly, I want to make sure that I reiterate this again. Okay? We're not out of the woods yet. The next big hurdle for us are the spring breakers, because we're getting into March and April. This is where, traditionally college kids goes to warm places, they intermingle and maybe share diseases and then bring it back. And there's some news about some colleges are canceling spring break and trying to make sure that people are safe. Stay safe, wear a mask, wash your hands, physical distancing. Okay? Get the flu shot. We've got 2 weeks before you get the COVID shot. Okay? But make sure that you're staying safe, because if you miss something, usually that can come back to bite you. And that's what our experience is be safe, get yourself vaccinated, so that we can all come back to normal, hopefully soon. Now, I wanted to pivot a little bit about what's happening in our healthcare technology and COVID in general. We talking about vaccine and talking about vaccine technology that accelerated through this this COVID crisis. Healthcare technology too. We have accelerated many of the technology that we've been using, and so I wanted to introduce to you and your audience a little bit of what we're doing as Kaiser Permanente in terms of healthcare innovations in this virtualized integrated healthcare network. And so Kaiser Permanente, we've been doing integrated medical care for a long time. We've had a healthcare delivery system with a electronic medical record as a backbone. You have access to virtualized care through kp.org for some time now. Now through COVID though, we're able to push that forward, and we have the entire team behind you so that you can access telehealth through phone services. We have what we call e-visits, where you can go and visit, and some of you may have used that. If you have COVID symptoms, we can actually quickly go through an algorithm. Same thing with COVID testing, as well as COVID vaccinations. And we also have in-person care. During this time of COVID challenges, Kaiser Permanente, we're always there. We haven't closed. Many of our clinics remain open to provide not only virtual care, but also in-person care. Now, on top of that, we are pushing forward with the virtual frontier. We're piloting some remote diagnostics. We have people, with home blood pressure monitors. And in the past, you had to come to our offices to get your blood pressure measures. Now we can actually use some of these remote monitoring machines to help with blood pressure control, diabetes, sugar control. We have remote monitoring for cardiac rehab programs that we're piloting. And then soon we will be pushing this even forward with chatting with providers and hopefully connected wearable devices. Many of you have these watches and things like that. So these are our long-term vision for furthering healthcare innovation. Healthcare is never going to be the same after COVID. And we don't expect to go back to the past where people make an appointment, you have to, park your car, and then you have to, come and see us, wait in the waiting room, and the whole process of healthcare has been shifted. And I think we should be able to retain these wonderful advances. And just the other day, I had a patient who actually is currently in Fuzhou, and he actually made a telephone appointment with me and consulting me about his care in China. And he's a Kaiser Permanente member. I mean, the world for telehealth has expanded through COVID, that we can reach anybody anywhere in the world as long as there's a Wi-Fi network. Okay? And so I think there are some positives and silver linings coming out of this COVID crisis that will benefit our patients from this point on. Now, talking about benefiting patients, though, one of the areas that we want to make sure that we focus on, and many of our patients, and talking about school children too, mental health is foremost important because, we are social people, okay? Human beings need socialization, and through the COVID lockdowns, we're noticing that mental health issues are coming up. Addiction, alcohol abuse, other drug addictions are spiking. And so the demand is there. 1 in 5 adults in the United States have some mental health issues. And with this increasing demand, with the increasing in the stress and we have school pressures, workplace pressures, COVID anxiety, depression, we have the stigma of being locked in. We're seeing suicide rates are spiking. More than ever, we need mental health support for all of our family, friends, and employees. And so Kaiser Permanente, through this, I want to introduce a couple of digital applications. The first one is My Strength. If you're a Kaiser Permanente member, you can actually log on and you can have this for free. It's a cognitive behavior therapy-based program, and you can go on, it's complete confidential. You go on your kp.org app, and you can go through behavior therapy, helping with depression, anxiety, helping sleep, managing chronic pain issues. And then many of you may have heard the commercial, the add-on Calm app. It's one of the leading digital apps for stress management. As Kaiser Permanente members, and I'm one, I've been using that. You get a premium version for free for the first year. And so, it's daily calm exploration, guided meditations. There's music to kind of help you sleep. And so it's a free benefit for Kaiser Permanente members. And with that focus, we want to make sure that we're expanding all these services. We're aggressively hiring additional mental health providers, opening new offices. And what's more is, we're converting many of these groups. We can't do in-person meetings, but we have now Zoom type of meetings that are secure, and individuals and group sessions. And so we do offer these telephone and video visits. And then what's more is that with our colleagues now, I'm in primary care. My psychiatry colleague actually is rounding in my offices. So at any time that my patient needs, I can just call over my psychiatry colleague and say, hey, can you help me out with this? So we're gradually integrating mental health services into primary care offices. And with that, I think just about time for some Q&A.
All right, thank you, Dr. Chou. So we actually have 2 Q&As that we want to actually save it for you, but you have the Q&A page, so why don't we just go ahead and start. So we actually have a question from one of our viewers. So she says, what is the outcome for a type 1 diabetic and for children that are type 1? I guess she meant maybe just the coronavirus in general, and also if they were to take the vaccine, assuming they are old enough to take the vaccine.
Right. So, type 1 diabetics, any diabetes is considered at risk, but especially uncontrolled diabetics. So A1C greater than 7.5 and above is considered a higher risk. Because what we know is that sugar does impair immune systems. And so if it's your time, please get your vaccine. In terms of the risk of side effects, it's the same as any other chronic conditions in any other person, actually the side effects are usually generally mild and short-lived. And as long as you don't have any prior vaccine anaphylactic reactions, you should be able to take the vaccine. And I encourage you to do that.
Yes, definitely. Because you said that 95% of your colleagues have gotten the vaccine already.
Absolutely.
So if the doctors are doing it, the doctors trust the vaccine, and it's for the greater good of, for getting through this hurdle, then it's highly encouraged by your team, you and your team. Okay, so we also have a personal question. This is quite personal. She said that she's taking losartan, HCTZ, 50-12.5 milligrams daily. What kind of vaccine is suitable for this person? So she's female, and she's asking this question.
Yeah, so that's a very good question, and that's a very common question. Is with all these choices, which one is most suited? But all of them are, and the question is, which one can you get into your arm first? And this is the issue of limitation. With vaccine distribution, Johnson & Johnson is just coming out and they're ramping up the delivery. We're not expecting Johnson & Johnson to be, the administration is saying that 100 million doses by, a month, probably another month. We have vaccines for Pfizer and Moderna. Wherever you can get, the first shot, you have to. Now, this is the thing, is you cannot mix them. And that means that if you get the Pfizer, you should be getting Pfizer. If you got the Moderna, you should be getting the Moderna. Okay? And so you should not mix them. Now, remember, all the side effects I read up on all these, it's the same. No one is better than the other. People may be worried that, in folks' minds, you may be thinking about, okay, one shot may be less effective versus 2 shots, maybe 95% effective. You have to realize that the studies are done at different times. And now there are newer studies that shows that, they're pretty much equal. And I think the consideration with the South African variants, these vaccines may be a little bit less effective. But if you really look at the effectiveness, the reason why we do vaccination is to prevent death. And all 3 have that as an effectiveness, is that when you get the vaccine, yes, for those folks who unfortunately get the COVID disease, you don't die. And I wish you not to die, right? I take care of, I round in the hospital, and through December, we're seeing a lot of folks, unfortunately, like I mentioned, is one person got together and infected everybody else, and there are tragedies. We want to prevent that tragedy from happening to your family and your friends. Please get yourself vaccinated.
Thank you, Dr. Chou. So we have another question. Most people said Pfizer is less efficient than Moderna for Asians. Is that true?
Yeah, that's a very interesting question, because I did research on this because at the get-go, when the Moderna just came out, there's some again, internet, and actually my wife said, do you know that this is? So I looked it up, and I said, is this truly, really true? So I looked up the Moderna study. And so, yes, in part, it's partial true. And the reason it's partial true is this. Moderna tested their vaccine in India, okay, South Asian. And in that South Asian subgroup, okay, it's 100% effective, meaning that nobody in that small subset got sick. Now, if you translate that to the general population, though, it extrapolates to about the same, around 95%, 94.5% effective. Now, when you talk about Asians, right, and I'm a Far East Asian, Taiwanese descent, so you can't really compare. I mean, this is South Asian Indian population. So when I said that to my wife, she goes, "Oh, okay, well, it's about the same." Okay, so like I said, again, it's not, one or better than the other. It's a shot is better than no shot.
Yes, thank you, Dr. Chou. So that is the end of the questions for the medical portion of our presentation. So anyone has any questions, please just type into the chat. I'm actually going to go through a little bit of my presentation. So thank you, Dr. Chou.
My pleasure.
Chief of Family Medicine at the Baldwin Park Kaiser Permanente. So if you want to stick around, and maybe there are going to be more questions coming up, let's go through my presentation and we can go over a little bit about what I can present. So I just want to also mention that Kaiser is one of our long-term partners that provides benefits to our clients. So we are an insurance company, even though we do insurance, but we also provide a lot of community information to our friends and families, our clients, and just, in general, helping people get through this coronavirus period. So with that said, I want to go to the first page of my presentation, which has a little bit about the background of the CARES Act. So I have it in Chinese also. I'm not going to go into too much details because we want to make time for more question and answers and also the raffle. So I just want to go through letting people know that the CARES Act actually required insurance companies and plans to cover all the COVID-19 preventive services at no cost. I think in the very beginning, there's actually some kind of copay planned, but due to the current climate, the preventive services are at no cost. And with Kaiser, they provide the vaccination to in-network, their own clients, their own patients, and also out of network. So that's really amazing. So some of the carriers are doing that. And that applies to your regular commercial health insurance that you either get through Cover California or individual insurance or an insurance provided by your employer. Some of the self-fundings do cover it, and also the vaccine services at no cost. So let's go to the next page. So there's some information about, what the CDC says and also what the state is saying. So obviously, if you're in a different state, sometimes the rules are a little bit different. Next page. So I want to talk, before I go into the details of the slide, I just want to make sure that if you're an employer, you can have several options of insurance plans. You could have a group insurance from insurance companies such as, Anthem Blue Cross, Kaiser, Blue Shield, Health Net, and such, or you can have self-insured plans. Or you might have some plans that are grandfathered before ACA came into play. So all of these type of insurances might give you different benefits to how you receive your vaccine. So your vaccination might be covered by your pharmacy benefit, or it might be covered by your medical benefit. So please make sure you talk to your insurance specialist to see how you can use your insurance to get the free vaccination that's provided by either the government or your providers. Okay, so my presentation is based on like Q&A format. So our question is, what is the COVID-19 vaccine cost to my group health insurance plan? So so many carriers won't charge its members or employees for vaccine, like we already explained. And vaccine doses purchased with taxpayer dollars are required by the federal government to be free. So out-of-network providers from any facility has been approved by COVID-19 vaccine provider. It should be free, and non-members will also be able to get the vaccine through at no cost at many places. Okay, next page. All right, so earlier, Dr. Chou explained the different phases, and I just want to show it visually what they are. I think we are, trying to vaccinate as many people as we can, and Dr. Chou can verify this, and it's based on also how much supply we have. So right now, I believe that we are already past phase 1B. So we're in the middle of phase 1B, and then there's also phase 1C and phase 2. So the last phase is for people who are age 16 and older, and people who are not previously recommended for vaccination. So this is also listed in many of the governmental websites and also insurance websites. So for more details, you just gotta, check the news, making sure that you are in line for the next vaccination phase. Next page. Okay, so does the health insurance cover COVID-19 vaccines for furloughed or laid off employees? 我讲一下中文哈，健康保险是否涵盖留职停薪或是解雇员工的新冠疫苗？那答案是 yes. So yes is a short answer, but if the employee meets the plan's eligibility requirements per the carrier's definition as an active employee or COBRA participant, then yes, it is covered. The COVID-19 vaccine is covered for free for this employee. So, but we just have to be mindful for everything, you know, the situation of why you're furloughed, what kind of rules are listed in your employee's benefit book. And also, as an employer, you should always consult your compliance officer, whether if it's your legal consultant or your insurance agent who has an HR support, or your actual HR support office. So let's say if this employee is no longer qualified, then, you know, some examples, what they can do is they can go through Medi-Cal, they can apply for individual insurance, etc. All right, so next page. All right, so can the health insurance plan cover a COVID-19 vaccine for an employee who has waived coverage? So 健康保险计划是否为放弃保险的员工提供新冠疫苗? So the answer is no. If you already waived insurance, according to ERISA, Employee Retirement and Income Security Act of 1974, which mandates that the health plan assets are used exclusively for the benefit of health plan members, then the answer is no, because you are not a member of this group insurance. So if you're a employer, so you have to be really careful with, you know, offering any kind of benefit to people who are no longer or waive their coverage to join the group insurance. Okay, so again, we can establish alternative means. They could, if they're low income, they can go into Medi-Cal. If let's say they are with their spouse's insurance, then they can go with their spouse's insurance coverage. Or if they have individual insurance, they can go through the individual insurance. Otherwise, you guys can consult counsel to see what is the most lawful thing to do. Next page. Okay, so this part is a little bit close to legal. I'm just going to go through it really quickly because I want the employers to actually talk to your legal advisor to see what is the best solution for the situation. So the question is, if I mandate a COVID-19 vaccine, is there a lawful precedent in case my employee refuses to take it or sues the company for wrongful termination? Some people are asking, they don't, you know, some people, they just don't want to get the vaccination. So this is something that is in discussion right now. I just want to bring up certain topics that you can discuss with your lawyer. So 中文就是，如果我强制接种新冠疫苗，如果是一个雇主强制他的员工接种新冠疫苗的话呢，假如我的员工拒绝接种或起诉公司非法终止疫苗，是否有合法的先例？所以目前来讲说呢，there's several situations. So we have the Supreme Court rejecting multiple lawsuits stating that vaccination is infringing people's rights. So there's, you know, the Supreme Court already rejected the lawsuits. And the second bullet point is that the concept of mandatory vaccination is not a novel issue. So it's been discussed before, so people are aware of the situation. So there's a lot of literature that people can look up or even talk to your HR provider. And also, you know, healthcare workers are needing this type of vaccination. So please consult your legal advisor for more details. And let's go to the next page. All right, so I want to provide a little bit of a reference for our employers of the opening strategies, some things to consider, but really simple 8 steps. 企业开放的8部曲, so we're just going to make it really simple. First of all, you got to communicate with your employees often. Make sure your team leaders are in touch with all the employees. Everyone feels like they're coming back and no one's being left behind. Okay, so especially like if they need transportation or childcare, the employer should be really aware of the situation and address it when your employees need them. And secondly, consider remote working or with minimal physical contact. So most offices, there's not much physical contact, but if you're a restaurant or something, you can consider contactless services such as curbside pickup or different solutions for that. So the third thing is tailor your safety measures, possible vaccination requirement. So like Dr. Chou said, in his workplace, 95% of his colleagues are all vaccinated. And that should be something that is communicated with their employees to make sure that everything's compliant, that the cleaning and hygiene of the whole office is being considered. There's safety measures and redesigning of the office, maybe putting up some barriers. So the fourth thing is focus on training and education. So making sure that everyone is aware of how, to stop the spread of COVID if people are not vaccinated. And encourage employees to stay home when sick. So that's, very obvious. If they don't feel well, they should stay home. It could be anything, it could just be flu, but it's better to stay home and rather than at office. And the next one would be prioritize employee mental health. Dr. Chou already mentioned it. People are social animals, if you are working remotely, it's very important to stay healthy mentally and physically. Next is workforce stigma. There's a lot of racial situation recently, so it is very important to educate your employees to find a situation where people do understand the current political climate and accepting of each other. All right, so action plan if employees are exposed to COVID-19 at work. So this is very important because there is a possibility that the employees, when they return to work, they might be some kind of contamination or, infection of COVID-19. So you have to think about how you will address the situation, how you will communicate with the employees, and how you will protect the infected employees' rights. Next. Okay, so lastly, I want to remind the group, the employers to reevaluate your benefits strategy, 保险福利的审核. So due to the coronavirus, your benefits, it depends on your industry. Some industries are doing really well, but a lot of industries are very economically impacted. So that doesn't mean that you should not provide benefits to your employees or even to yourself if you're super small, a local shop, mom and pop shop. So instead of staying with your insurance plan, you may look into something that has a smaller network, but the benefit might be similar, or something that has a higher deductible that still has the catastrophic coverage, such as hospital, such as, all the, things that pertains to coronavirus. So it's very important to kind of look at your policy and see if you could do some adjustments. So, so there's actually, things are lower premium, but you still have the online teledoc. You still can see a doctor online. In China, like Dr. Chou was saying, you can still have the HR support and you can still have a lot more benefits on there. So make sure you consult your insurance specialist. Next. Okay, so we're in my Q&A section. So where can I get a vaccine? This is also mentioned earlier. There's a website called myturn.ca.gov. So if you go into that website, there's actually a phone number you can call that is available from 8 to 8, Monday through Friday, and Saturday, Sunday is also open. You should also contact your doctor if you already have insurance or pharmacist, and you should reach out to your county public health department. Okay, so this question is, do members of a health plan need a doctor's script or referral prior to getting their COVID-19 vaccine at a pharmacy? For the general most part, no. Members of an insurance plan, they are able to receive a COVID-19 vaccination without a doctor's script or referral at any pharmacy. So, but I encourage you looking at your insurance card, talk to your insurance agent to make sure that you follow the health insurance plan's guidelines. Okay, so also you can visit a different place for your second dose. But like Dr. Chou was saying, make sure that when you get Pfizer the first time, you get Pfizer the second time. If you got Moderna the first time, make sure you get Moderna the second time. So, but I believe that once you got your first vaccination, you had that little card of your vaccination record. So just make sure that you bring that with you for your second dose. So with that said, I'm looking at the chat room. There's actually questions in the Q&A portion. There's one question saying, a patient went to emergency room per doctor's suggestion to check for COVID-19, but the result was negative after staying at the hospital for 3 days. The hospital said the patient should pay for all the cost. Does the federal pay for the costs? Is there a law about this? So I have some answers, but I want to see if Dr. Chou wants to chime in on this.
Sorry, I guess it depends, I guess, right? If it wasn't clear if it's because the test itself, it's one thing, but the treatment, so I don't, there may be other conditions why they have to be there for 3 days. I'm not sure.
Right. Yeah. So for my industry, if I'm looking at the situation, I do see that it's an emergency room. They went to the emergency room. So once you're in the emergency room, you are subjected to your emergency copay or co-insurance. So regardless of the reason. So so let's say the patient went to emergency room per doctor's suggestion. Maybe they already have symptoms, but really in terms of insurance cost, or it's regardless of what kind of situation you have. And the patient needs some kind of emergency service. So yes, if they have insurance, then they would be responsible for their portion of the cost. And this person should definitely, I highly recommend, talk to their insurance agent to make sure that they're not overpaying, because sometimes when the patient is under anesthesia or the patient is unable to talk, maybe the hospital will not be able to see what kind of insurance they have to identify what their actual cost is. So please make sure you have your emergency bill with you, along with your insurance information, before you approach the insurance agent to show you how to look at your explanation of benefits, look at your insurance bills, and pay the appropriate cost instead of paying what you actually see on the bill. So I hope that answered your question, because every situation is unique. So I highly recommend you get tailored service from your insurance agent. Okay. So with that said, we have a raffle draw. So make sure we include Dr. Chou in it. All right, so we're gonna have our team do the raffle. We actually have $20 gift cards. And let's see what the first winner is. I believe we're getting like 3 winners, right? All right. We're just gonna do 3. I'm feeling like 3 today. Let's do it. Okay. Okay, we're gonna raffle out our first winner. Let's see who our first winner is. We have Kathleen Cage. Congratulations, Kathleen. Is Kathleen here on the line? Okay, so Kathleen, you have until we pick the third winner to let us know if you're still online. If you're not, then we're gonna pick the more winners. So let's look at the next raffle. Let's try the next one. Catherine Wayne, are you online? I think Catherine is online. Let me see. Oh, Catherine's here. Congratulations, Catherine. You got your $20 gift card. Yes. All right. So let's do the third winner. Ariana Lowe. Thank you, Ariana. Congratulations. I do see your little hand being raised. So we see that, and please give us we do have your contact information, so we'll be sending you the raffle shortly. So I don't think the first winner was there. Did the first winner check in? If she didn't, then we're gonna pick another one. All right, so let's pick another person. All right, who's our lucky third winner? Joyce Lynn. Congratulations, Joyce. I appreciate your attendance, everybody. So with that said, let's look at what we have. Oh, she's online. All right, so apparently the first winner was online. So we're just gonna give out four gift cards today. We're really generous, right, Dr. Chou? Thank you. All right, so with this information today, I think everyone learned a lot from Dr. Chou and hopefully a little bit from me. So we will be sending a copy of the PPT to every attendee and also the recording of our class. So we'll make sure that Dr. Chou will get a copy too. And next page, please. And if you're looking at this on a desktop and you have your phone handy, just make sure you take your phone out and then do your camera and face your camera on the QR code. You'll be able to get a free COVID vaccine ready assessment. So we can see if your insurance has a benefit and you are compliant. And we can kind of tell you where your benefits are so you know how to use your insurance during the pandemic. And also that with that person that went to an emergency, we can definitely tell you how much your copay is. Next page. And please leave us a review. So if you liked today's seminar, please go ahead and leave us a positive review. And we really appreciate your attendance. And this is our website, our Facebook, our YouTube. If any questions, you can contact us through those methods or email us or call us. So thank you again, Dr. Chou, and thank you every attendee for attending. And Dr. Chou, again, he is at the Baldwin Park Kaiser Permanente. And if you want to see him, you have to make an appointment. Is that correct?
Thank you. I appreciate the opportunity with working with EPIA 权威保险，谢谢你。
谢谢你 ，Dr. Chou， 非常感谢。我们希望下一次可以用中文来呈现，所以下次再跟你
没问题，希望下一次有机会。好，拜拜。
谢谢，拜拜，Bye everybody。